Ed Martel here from the OAI. Recently I had a video that I posted where I was working with an athlete and someone commented on my leg, and I'm an amputee, and they were wondering how hard I can throw, which I thought was pretty comical, but it just started me thinking. They wanted to know how I lost my leg, and then that started off with a bunch of people kind of inquiring about the same thing. And it's not something I normally talk about, but it really started me thinking about what I wanted to do with this program and how important it is to me to create something that can truly benefit athletes. And just to answer the question and then talk about the goal of the whole program and what I want to accomplish. But I've had the opportunity to be a therapist for 17 years, and it's been a great pleasure. And a lot of the things that have happened to me have been the result of things that some people would view as difficult things to deal with. And people ask me a lot, especially my patients, what happened, and I'm like, okay, well, how long do you got? But it started back in physical therapy school. I was diagnosed with non-Hodgkin's lymphoma, and it was everywhere. It was in my bone marrow. It was 90% involvement in my bone marrow. I had lymph nodes that were all swollen. I started noticing when I was squatting that I had these little bumps on my shoulder and under my armpits, and I didn't think anything of it. And then I started to feel really fatigued, and went to the doctor after my mother kind of pointed out that I looked yellow, and they found that I had lymphoma. And so that was the first year of physical therapy school, so I had to make the decision, okay, what am I going to do? So I went to the doctors. I went to multiple different consultations, and then they told me that I had to go through chemotherapy. So I had a very rare cancer for my age group. It was a low-grade, indolent, slow-growing lymphoma, and they said I could live with it for a lot of years, and a lot of times chemo takes care of it for a while, and then it kind of keeps coming back, which was, okay, well, I'll do what they tell me to do. There was many people that thought I should maybe not continue with therapy school, or I didn't know what to expect, but I'm like, I wasn't going to do that. That's like admitting something's going to not work out. And, I ended up having probably better grades as a result of having to sit in a chemo chair for 9 months for 5 days a week than I would have if I would have had to go to class. But, so I went through, it was called Rituxan and fludarabine, and the statistics on that were 3 to 7 years, and they got it to where it was less than 20% in my bone marrow, and then on your merry way. My lymph nodes were fine, my spleen wasn't enlarged anymore, and I was feeling great. And then during physical therapy school, my wife was in physical therapy school with me, and we met, and we met in school, but we didn't start dating until the very end. And I thank the lucky stars. She agreed to marry me with an indeterminate outcome, which some people might view as crazy, but it was fortunate for me. And the cancer ended up coming back in 2.8 years, so just underneath it seems like that's how things worked out for us. Just good, but not quite great. But then I was confronted with the choice to go through more chemotherapy or a bone marrow transplant, because they had done blood work on my family and found that my sister was a perfect match. So I went through the bone marrow transplant and was going to get married in October after I went through the bone marrow transplant, which some people thought maybe overly optimistic. But once again, what else are you going to do? The one thing that I've learned through the things that I've been through is you just got to keep doing it. You don't know what your outcome's going to be, even if you're not a cancer patient. So I went through the bone marrow transplant, and I had to stay in the hospital and down in Houston at MD Anderson for 100 days, and they let me out of the hospital in 19 days. You're in an incubator room because your immune system's all suppressed, because you had to go through really aggressive chemotherapy to start it, which was not the easiest thing in the world to do, but it's just what you got to do. people ask me a lot as patients when they find out, either, because my wife works in one of the physical therapy clinics that we own, and they'll be asking her questions, and they're like, how did you guys get through it? And I'm like, because you go where the doctors tell you to go. I mean, you put your faith in people that have dedicated their lives to doing the things that they do, and hopefully things will work out for you. And fortunately for me, they did. And after they let me out 19 days, and I was one day away. I wanted to break the record, but there was a little 12-year-old girl that got out 18 days, and that was ticked me off a little bit. But after 19 days, they did blood work and PET scans, and they found that I was completely free of cancer, even at the molecular level, 12 days after I went through the transplant, which was miraculous. So now I'm, completely optimistic, and things are going well. I got married. We weren't supposed to be able to have kids because of all the chemotherapy that I went through, and then one day my wife calls me because she went to the doctor, and okay, we're having our first child. So I've been blessed, but there's been some things that I had to endure to make me appreciate the things that I had more as a result of the things that I had to go through. And it also was, a part of the reason that moved me in the direction that I became a therapist, because of my baseball injuries. And I wanted to do something to make a difference, and I wanted to know what I could have done and what I could pass on. I didn't have these legacy thoughts when I was younger, but that's what this whole program was about. I wanted to leave something or do something that would impact more people than the people that had found out about me that became a patient through a physician or through someone that I knew or somebody who got injured. But going back to the story, everything was going great. We had our first daughter, and then my wife had just given birth to our son, and then 6 months after that, I actually ended up with a pneumonia that got into my blood, and I went into septic shock, and all of my organs shut down. I had to go on a ventilator. I was in the hospital for 15, 14 days in ICU. I can't remember it. My wife knows much better, but I woke up after I was in a coma, and my fingertips were all black. My feet were all black. It looked like I'd been going barefoot in the Himalayas. And they told me that I was going to lose most of my hands and my feet and maybe both legs. And my kidneys had shut down, so I was on dialysis every day. And that was, it was what I had to do. You go where you go. They said that I was very fortunate to survive that incident. The statistics were not very good. They actually told my wife that it was most likely that I wouldn't make it. But I did. And, I've had some things that have had happen that I don't really view of them as, I could have done without them, I guess, but I don't view them as they were horrible things. I've had great fortune as a result of some of the things that have happened to me. And, I went back to work. I had to go through amputations. So I lost 5 fingertips, and I lost the toes on the right side. My left lower leg is gone. I was supposed to have the amputations, but they found blood clots in my lungs, and they had to wait till the blood clots cleared up for me to go through the bone marrow transplant, which actually saved much more of my fingertips and ended up working out better for me than if I wouldn't have had the blood clots. So, the doctors told me we would have probably cut off more of your fingertips, more of your foot, and maybe more of your leg. So I had one good thing happen and one bad thing happen, but it worked out in the end. So, I've had some misfortune, but also a lot of fortune as a result of those things. So I went back to work, and things were going well. My cancer was gone. The most difficult part of dealing with cancer isn't the actual dealing with it when you're going through the treatments. It's as you get further and further away from the diagnosis after they've told you that things are fine, the trips back to the doctors for your checkups become more difficult to compartmentalize, because you realize as you start implementing yourself back into life as if nothing's wrong, you realize that things can come to a screeching halt 3, 4, 5 years down the road, but that once again gets easier to deal with. So I ended up having to go through a kidney transplant because they were waiting for my kidneys to come back, and they never did. And the same sister who donated me the bone marrow was the one who gave me the kidney. So now I have the kidney of my sister who donated the bone marrow, and I don't have to be on immune suppression medication because my immune system is my sister's immune system. So once again, I had to go through something bad, but things worked out even better than you would expect, because now I don't have to take much of the medication that most people who have a kidney transplant have to take. So as those things start happening, you start contemplating things you didn't contemplate before. You're confronted to deal with your mortality in a way that a lot of people aren't at that age, but it does. It crystallizes things for you, and it makes you realize that, what, I think that after having worked with as many shoulder athletes as I've had, and as many things that I've seen bad happen to athletes with bad instruction, or what's happening online with these programs that are trying to promise you something that I've purchased, and you're like, that's just not clinically sound at all, and there's really no specificity in that. But I started to move in the direction of thinking along the lines of what could I do. But I had the kidney transplant, things went great, and then in 2014 they actually found a tumor in my spine, and I had to go through radiation. So now I had pain in my back, but then I had an indolent lymphoma tumor, but I didn't have any of the other stuff that I had before, which I thought surprised. I think that surprised a lot of the doctors that I didn't find any cancer anywhere else. But I went through radiation, and then that went fine for a year. But then I started to feel pain in my upper back, and once again I had another tumor. And after you've had one tumor that's localized to one spot, another tumor, the doctors consider that systemic. So then they decided to give me more chemotherapy, and now, the things that were available 10 years after my transplant were miraculously easier to deal with. They've advanced cancer medications and chemotherapy to the point where what I had to go through before was 10 times worse than what I had to go through now. I just show up, sit in a chair for a couple hours, and I didn't get sick. I didn't have anything. It's like, okay. And then they did some tests, and they said that tumor was gone. Unfortunately, 6 months later it came back, and so then the decision was, okay, they had just approved a medication, the oral stuff that, I take a pill, but they did radiation on that tumor, which was something I thought maybe they should have done in the first place, but they did radiation, and now I take a pill. So since 2015, I haven't had any issues related to cancer, and I take what's called an oral Imbruvica, which is an engineered therapy that assists your immune system in recognizing the tumor. But that's kind of the thing that has motivated me the most to do what I'm doing now online. Is I was 45, 46 years old. I'm 48, and I had done more investigation of what was available online, because I started getting more and more patients that came to me that were telling me I bought an online program and my arm started hurting. I started throwing weighted balls, my arm started hurting. They told me to increase my stride length, and my arm started hurting. My coach implemented a program, a plyometric Olympic-style lifting program, and my arm started hurting. I'm like, okay, where is this information coming from? And so the more I investigated, the more I realized that the people who were promoting these programs were trying to convince athletes that these things were things that would make them throw harder, because I know that's what all athletes are looking for. But I was like, wait a minute, it takes a lot of specific repetition, and it takes a very, very critical evaluation of an athlete's body type, structure, habits, posture, asymmetries to develop a program that would potentially help that athlete. So that's what set me on the pathway of creating the corrective exercise program, as well as the phase-specific throwing program, because I wanted it to work. I wanted to combat this nonsense that was out there that was really doing, in my estimation, more harm than good, because I dealt with the athletes who got injured as a result of those programs. So I wanted to make sure the exercises could be something that could be continually used, so that athletes would know how to address postural deficits and create more strength in the eccentric musculature that controls how velocity is created, that could have more flexibility in their hamstrings, simultaneously working on muscles that I know need to be strong. And you combine that with the phase-specific throw program, I wanted to teach athletes to be more biomechanically efficient, which would over time transform their throwing mechanics more into a biomechanically efficient model that would allow them to tap into their true potential. You know, we're limited by genetics. I can't make somebody 6'5", 6'6". I can't make someone who has a limited amount of high twitch fibers all of a sudden throw 100 miles an hour, which I found to be comical, because you can throw 90 tomorrow with these websites if you do these 3 things, or if you use these balls, you're going to automatically. And of course, it's testimony after testimonial of people who, you know, had benefited from these programs, and I applaud the people that are trying to help. But when I started investigating these programs, I realized there really was not a lot of information there. There wasn't any specificity. There wasn't anything that could really transform an athlete into a better athlete, you know, which is something that I think physical therapists as a profession have done poorly, promoting themselves as the one who truly understand how to change an athlete and move them in the direction of a more biomechanically efficient model by addressing physical restrictions and limitations and how they move. So the whole program was designed to change how athletes move so that they could tap into more rotational acceleration, tap into more linear acceleration, and then teach athletes where they need to be at certain strategic points of the throwing motion, so that when they use corrective exercise, which is the whole point of the corrective exercise program, to transform an athlete, and then you combine that with a kinematic sequence that gives the athlete the opportunity to get new muscle memory, new kinesthetic awareness, so that they can over time gravitate towards a more efficient model. And then as a byproduct of that, you will throw harder. You know, the more inefficient you are, and we see this all the time, you know, the worse someone's mechanics are from a physical perspective. If their moment of inertia is long, if their lever arm approximation is long, then I tell them, you have the potential to throw much harder. There are some athletes that come to us with, you know, they're a little bit off, but if you work on these things consistently, you'll get better. And if you get better being more efficient, you'll end up tapping into what your true potential is. So the program was designed to make athletes work hard. But the reason why I did it was all the things that happened to me that made me start thinking along those lines. And some of my health issues were a big component of that. I wouldn't necessarily say they were the biggest part of it, but it really made me start to think when I started to look back at, you know, what happened? How did this happen? You know, some of it was I realized that there was things out there that were not sound, but a lot of it had to do with the fact that I wanted to do something that I thought truly could benefit athletes for the remainder of their playing career, and then give that athlete that maybe had to deal with what I had to deal with, which was losing a career as a result of injury, and seeing people that you had competed against go on to long, lucrative careers in the big leagues that, you know, I mean, they would probably argue it, but that I thought I was as competitive or as better than they were. But, you know, in the end, that's spilt milk. You know, complaining about what you didn't have doesn't do anything. You know, it's doing something about what you can maybe make an impact on is what's more important. And that's kind of how my health history has made me think that it's benefited me more than hurt me. Yeah, I'd like to have my leg back, and I'd like to be able to use my fingertips better, and I'd like to have no pain in my foot, because I deal with pain in my right foot. My kids call it my muffin. But there's nothing you can do about that. But what you can do is do something about what you can do to impact other people, which is why I think that the career that I stumbled upon as a result of my injuries was the best thing that ever could have happened to me, because now I get the opportunity to impact young athletes, and they believe me, and they're compliant with what I tell them to do, because one, I was a former athlete. I am a physical therapist. I have specialist certifications in orthopedics and manual therapy, and I've done everything I can do, which is what I think I had to do because it's my obligation to do it. It's my obligation to learn and educate myself as much as I can to try and give an athlete the best opportunity to recover from what I didn't recover from as well as I would have liked to recover from it. So, it was interesting just to have that question. Somebody asked me about how hard I could throw with one leg, and it really started me to think about why I'm doing what I'm doing and how much I want it to work. I really want this program to work. I really want to modify it in whatever way I can to try and impact as many athletes as I can so that more people can find out about what we're doing and how what we believe and what I know to be different than what's going on out there in the internet. I don't find any of the programs using what we're doing in terms of resistance exercises at the end range of your physical mobility and trying to address specific asymmetrical deficits that really have a huge impact on how you throw the ball. You can ask an athlete to throw a ball hard, but if they've got tight hamstrings or tight hip flexors, or they have no hip abduction, or they don't have good scapular mobility around their rib cage because their serratus is weak, then you could potentially harm someone, as is often the case with the program that you intended to help, but you didn't have the clinical education to know how to address those limitations. So, to answer someone's question, it's 67 miles an hour is what I'm capable of, which is pretty pitiful in comparison to 95. But I really wanted to take this time to explain to people why I'm doing what I'm doing, how important it is to me, and I have therapists that are former college athletes that are in therapy school right now that are going to be becoming part of it, and how I'm teaching continuing education courses to physical therapists to learn more about how to specifically address throwing athletes, because the shoulder injury rate and the elbow injury rate, especially with as much specificity that I disagree with that's happening in athletics. I wanted people, I have these people that are helping me now, lost my train of thought, but I want this to be something that starts to spread throughout physical therapy and throughout training programs, and people use this program for their teams, and more people use us for video analysis. I see a lot of these video analysis software programs that can slow it frame by frame down, but that's not the most important component. Identifying a problem is the first part. I would say an important part, but not the most important part. Can you create a program using specific fixed progressions that train an athlete to move in a different way, which you can change regardless of their age? You can use corrective exercise regardless of their age. The goal of any instruction for an athlete is to maximize what that specific athlete can do, and that's the whole point of the program. So wanted to talk about that a little bit. We're doing a lot more work on Facebook and Instagram and Twitter, and those are arenas that I have no knowledge of. Luckily for me, the guys that are in physical therapy school that are going to be, they work with some of the throwing athletes that I work that are discharged from therapy now, and they're going to become part of the OAI. But I'm training and doing continuing education courses for physical therapists. I'm creating a certification process for OAI certified therapists, and the first year and a half of doing that, I've realized that it needs to be a much more extensive course because I don't have enough time to address the things that I need to address in the 2 days that I usually do a 2-day continuing education course. It takes much longer than that. But going back to what I said before, I've had some unfortunate things that have happened to me, but I don't view them as unfortunate. I've been lucky to get through them. But I don't take credit for those, but the one thing that I do want to do is make sure that I'm always looking at what happened to me for it to propel me to do more. That's the obligation I think that I have, is because of those things I should do more. It's my responsibility to pass along what I've learned, and hopefully in the end I can create something that a lot of therapists can benefit from, And it's taken a long time for me to feel that that's something valuable enough to teach. And I'm proud of it. I'm proud of this program. I really believe it works. I've seen it work. I've worked with numerous athletes across the spectrum of injury, and I'm never going to stop trying to improve it. So that's that. And we want you guys to subscribe to our channel so that you can see all the videos that we're posting. And that, like I said, that's an arena that I'm unfamiliar with, so I let the people that know how to do that stuff handle all of that. And my goal is to just create more content so that more athletes can be exposed to this program, and then hopefully that snowballs, which I feel is important to happen. So that's it.